Even though other issues have dropped in the medical coding world, I still wanted to finish providing you information from the calendar year 2022 physician fee schedule. In this video, I'll introduce my last topic. So the last topic I wanted to discuss from the physician fee schedule is teaching physician services. The Medicare Physician Fee Schedule, or PFS, reimburses treatments provided in educational settings if they meet one of the following criteria. First, they are personally furnished by a physician who is not a resident. Two, they are furnished by a resident when a teaching physician is physically present during the critical or key portions of the service. Or three, they are furnished by a resident under a primary care exception within an approved graduate medical education program. The billing requirements for teaching physicians are as follows. A physician must be identified as the teaching physician who involves residents in the care of their patients on claims. Claims must comply with requirements in the General Documentation on Guidelines and E&M Documentation Guidelines sections. Claims must include the GC modifier, which is this service has been performed in part by a resident under the direction of a teaching physician for each service, unless the service is furnished under the primary care exception. When the GC modifier is included on the claim, the physician or other appropriate billing provider are certifying that they complied with these requirements. If you meet the requirements in the exception for E&M services furnished in certain primary care centers section, the provider must provide an attestation to the Medicare Administrative Contractor, or MAC, stating that they have met these requirements. Claims must include the GE modifier. This service has been performed by a resident without the presence of a teaching physician under the primary care exception for each service furnished under the primary care center exception. The physician fee schedule provides some clarification, but before we get into that, let me say, hey there and welcome. If you are new here, you don't know me yet. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've served hundreds of students and helped them transform to become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Consider subscribing to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. Oh, and don't forget to hit the bell for notifications of my weekly videos. Teaching physician services, the AMA CPT office or outpatient E&M visit coding framework that CMS finalized for calendar year 2021 provides that practitioners can select the office or outpatient E&M visit level to bill based either on the total time personally spent by the reporting practitioner or medical decision making, or MDM. Under CMS's existing regulations, if a resident participates in a service furnished in a teaching setting, a teaching physician can bill for the service only if they are present for the key or critical portion of the service. Under the so-called primary care exception in certain teaching hospital primary care centers, the teaching physician can bill for certain services furnished independently by a resident without the physical presence of a teaching physician, but with the teaching physician's review. CMS finalized and clarified that when time is used to select the office or outpatient E&M visit level, only the time spent by the teaching physician in qualifying activities, including time that the teaching physician was present with the resident performing those activities, can be included for purposes of visit level selection. Under the primary care exception, time cannot be used to select the visit level. Only medical decision-making may be used to select the E&M visit level to guard against the possibility of inappropriate coding that reflects residents' inefficiencies rather than a measure of the total medically necessary time required to furnish the E&M services. You have learned about the teaching physician regulations. You have also learned that new clarifications have been provided in the calendar year 2022 physician fee schedule. Questions of the day. Did you know about this information? And what do you think about these changes? Let me know in the comments below. I would love to hear your thoughts. My final thoughts. Since the beginning of time, it seems like, but since the beginning of the physician at teaching hospital regulations back in 1994, with the audits from the University of Pennsylvania, things have been a bit complicated with the documentation requirements. However, it seems that CMS is really trying to remain true to its promise to the physicians to reduce the documentation burden on providers. And these clarifications are no exception. Plus, remember, we are in a transition phase where the evaluation and management guidance is changing. And we are currently using one set of rules for outpatient services and another set for inpatient. So just keep your eyes on the changes and you'll be fine. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. And if you are interested in more information on these tips and others on how to become a certified marketable medical coder, well then check out these videos and check this out. Are you interested in medical coding but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. If you liked the video, don't forget to let me know by hitting the thumbs up, hitting the subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you, so let me know you were here by providing a comment or asking a question. You can even stop by and say hi. You can also give me a little love by sharing this video on your social media platforms. Tag me in your video share at PRNcoding.edu. Let's stay connected and connect others. Well, you have stayed until the end. Let me know in the comments where you are checking in from, and do you think I should place a question here for a prize? If you want to learn more about the wonderful world of health information, medical coding, and/or healthcare compliance, then watch one of these videos. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and thanks so much for watching.